day, my name is Sister Mbali and I'm a professional nurse and midwife. Today we'll be talking about recognizing the signs of labor. A normal pregnancy will end at 37 to 42 weeks. So by the time you hit the 34 and 35 week mark, the baby is now nice and big and is literally right in between your pelvis. Your body is literally holding the baby with just the pelvic floor, which is a sheet of muscle. So you must be ready for discomfort. The body does, towards the end of pregnancy, release a hormone called relaxin, and this is so that when you're about to give birth, your bones are able to stretch out nicely and the baby can come out. But unfortunately, this hormone doesn't only work on your pelvis, it works everywhere in all your joints. So there's going to be a lot of discomfort. You might even develop what is called carpal tunnel. It's quite common for pregnant women, so there's a lot of discomfort. You'll be peeing a lot as well because baby's getting bigger. A lot of fluid is being generated by the baby themselves, and the body is constantly cleaning out the amniotic fluid, as well as your body. Your blood volume has increased, so you will be passing a lot of urine. But as well, the baby's head is on top of the bladder, so you will constantly feel the urge to pass urine, and pass as much as you need to, or try to go to the bathroom as often as possible so that you can prevent getting UTIs, which is also common in pregnancy. Once you are in labor, there are 3 true signs of labor. I've already spoken about the discomfort, which a lot of women sometimes mistaken for contractions. So you do have the muscle, which is the uterus, sometimes tensing up, but it's pain-free. That is called a Braxton Hicks. It's very normal, especially if you've had more than one pregnancy, because it's a muscle, and if you've been pregnant before, it's already used to the contracting. It might start to do that, especially towards the end of pregnancy. But once you start to feel like period-like cramps and it's lower down or goes towards your back, then you know that maybe something is starting. If it's before 37 weeks, please do not wait at home just saying, oh, I'm going to be fine. Please take a paracetamol. A pregnant woman can take 1 gram of paracetamol, but you can always get advice from your healthcare provider, because remember, if you have a high risk pregnancy, your care will be very different. If you're high risk, any form of discomfort and pain, it's recommended that you go to the hospital immediately. But if you're low risk, if after that 1 gram of Panado, after a few hours, you're still feeling the discomfort, it may mean that you are in labor and it's preterm labor, so you would need to go to the hospital. But if it's after 37 weeks, your term, so it means that the body is ready to get the baby out. So you can ignore those. You can alert your healthcare provider, especially if you're in the private sector, you have that privilege to do that. But if you're in the government sector, or you stay very far, I wouldn't then wait and just ignore it. I'd go to the nearest facility as soon as possible, so at least you know that you're at a safe place. And if you have to deliver, because other women are different, some women could feel those period-like cramps and not get into like a very strong contractions for them to dilate. Other women, they'll just feel that little bit of pain, but they're actually dilating. Others, on the other hand, they're not dilating, so that's why you'd still need to go into the hospital or to your midwife and get a check done. They'll also check on the baby as well. It's also very important that you know the status of the baby. They'll do what is called a cardiotocograph, CTG, where they listen to the baby's heartbeat and compare it to the contractions. So the contractions in the early stages of labor usually are period-like cramps, and then as the labor progresses, you have 3 contractions every 10 minutes, or they could be 3 minutes apart, 3 to 5 minutes apart. That's usually when you started. The labor is actually now, it's true. What can also happen is that the labor would start and then it stops, and then it starts again. Because as I said, it's a muscle. So until the muscle is able to get those regular contractions, then you will know that you're in true labor. But it still doesn't mean that you should ignore them. The contractions will get stronger and they don't stop until the baby comes out. The baby and the body are both working together to get the baby out. So to get the baby out. So you'll find that the contractions After each contraction, the baby is also going to move, and it's very important to note that if you're feeling the baby's movements, eat if you can, because some people feel a bit nauseous, so drink something or eat something so that baby can also have a bit of energy, and so that you can also have a bit of energy. The contractions are painful, but they're only extremely painful towards the end when it's time to push. But in the beginning, your body gives you time. You get into the labor quite easily, unless you have your waters breaking, which is the second sign of labor. The second sign of labor is the waters breaking, and you'll see the amniotic fluid. It's very important to note the color of the amniotic fluid. It should be clear, like not yellow, like urine-like, but there will be like a milky look to it, which is still quite normal. Other women just have it super clear, but once you start to see yellowness or any sediments, or it's green or brown, it means that the baby is stressed. The baby is now passing stool within the stomach, and the baby needs to come out almost immediately. So if you see something like that, if your waters break, you should be going towards the hospital. And another reason, if you have if your waters break, they need to check if the cord is coming before the baby, because if that happens, then the baby is also at risk. So it's always best to go to the hospital when your waters have broken, as well as you do expose yourself to infection, and you have about 24 hours before that risk increases. So they might start you on an antibiotic if it happens that your contractions aren't starting. The other sign of labor is a mucus plug coming out. It may not be a very true sign, because you find some women releasing some of the mucus plug, especially if it's still clear. It's like a discharge gel-like substance. It's not necessarily a true sign, but it means that the cervix is starting to prepare. If there's a bit of blood stain in it, it means that the cervix is actually starting to open. So that's how you can know that, okay, labor is starting. But if there's no contractions, then you might be sent home. It is still good to just go in and check, get a CTG done for the baby, and also get all your checks done. And if you're not in labor, you will be sent back home if you don't stay too far. If you still stay close and can afford to stay, especially in the private sector, then you would be seen to overnight.